I have this. Hey there, uh, Sarah Zink again, and I am doing my weekly plastic surgery Q&A here. So I had several of you send me some questions right before I started. So I am going to do my best to just answer these, but I am not going to repeat a lot of information that I've already covered. So you can see the first video, which talks about the why and the what. I also talk very specifically about the pricing, very specifically about the general pricing. I've ballparked it for you and broken it out. I've also posted a video with the physician who talked about what he's going to be doing. And so today I'm answering some of your questions. I'm talking about my experience here so far. I got here Thursday, and today is Sunday. So I've been here 3 or 4 days. And first day I was here, I went and got an EKG, and that was a whopping, it was $54, but I got the Jubilado discount because I'm an older person. So my cost for the EKG with a report was $45. I had already done my blood work back in Boquete, which is where I live here in Panama, and that was $20, I think, and it was the doctor's request for certain things. And then I met with the doctor, the physician's assistant. I asked a bazillion questions, my questions, and then I also asked some of the ones that y'all had suggested that you wanted to know, and I'm going to answer those here. And then I went and registered at the hospital, the pre-admission, and man, the system here is the doctor makes the order and you take that to pre-admission. And again, I'm at the Panama Clinic, which might operate a little bit differently than the hospital and definitely operates differently than the public hospital. But the experience is that you take the doctor's order in to the pre-admission office, and they basically tell you what they anticipate your costs will be. And because I'm an expat, I don't go in with, work insurance or anything like that. So I just gave them a credit card. But it is such a different feeling knowing what they expect the cost to be. And actually, when I came in January and I had a procedure done, they told me the cost and I gave them the credit card to cover that. And when I left, it was less. So they reversed the original charge and debited me less. And I'm sure none of us ever had that happen. So I want to be sure I answer your questions, but I'm working really hard not to repeat a lot of information here. So I have the questions that y'all sent me. I really am trying to be helpful to you and not lose my sanity at the same time. So some of the questions, again, y'all have asked why a lot, and I will tell you, this may come out unkindly, and I don't mean it that way. Women, I cannot tell you the number of women who have told me that they've had work done but didn't want to say anything, not because of men, but because of other women. And so I want to give you all a little tip. You don't really help someone when you're telling them, you're already pretty, I don't see why you're getting this done. And I want to explain that more fully. Basically, although you mean well, you're telling me that, and I know what you're trying to do, you're trying to reassure me that, oh, you're pretty, you don't need it done. This isn't about me believing that I'm going to be prettier. This is because I am short story, I'm comfortable. I'm not painful to look at, and I'm okay with that. But when a woman hears that, then again, you're validating my opinion or invalidating my opinion. So it might just be better for you to ask questions. Well, are you excited? Or what is it that you're hoping to achieve? Or maybe ask questions instead of make these value judgments. Because we say all the time that we want women, you know, be comfortable in your own skin and do what you feel like you need to do. And then you're validating or invalidating the decisions that I'm making. And so while I know that many of you are just saying these things to be kind and encouraging, what I'd encourage you to say to other women is, wow, that's great. What prompted you to do this? What are you hoping to achieve? Questions. Questions, I think, will be a whole lot better than, again, some of the stuff that you're saying that I know that you're trying to be encouraging, but it's not working. I swear to God, I have your questions here with the answers, and I'm just going to have to wing it, clearly. So I'm going to answer the why. Why am I doing this? Again, and I hope that I'm going to iterate it well. I have a mechanical issue up here in that the skin on my eyes is hanging down over my eyelashes. And so it is, some small ways, impeding my vision. I'm not using insurance. I don't want to go through the hassle. Enough of that. So that's one thing. And after losing 140 pounds, I have all this, which it feels like punishment. I know that it's a consequence, but every time I look at it, I'm just cringy. And so I decided that if I'm getting this done and this done, well, why don't we do some of these other things while you're in there? So I'm not doing this in an attempt to cheat aging or to, make myself prettier. I'm doing this to solve a mechanical issue, excess skin issue. And since they're in there, while you're in there doing a lube and a tune-up, let's change the tires kind of thing. So that's in essence my logic with all this. And yes, for those of you that have asked, my husband, Larry, fully supports this. So there's that. But I would also say to you, I want you, if you want to get plastic surgery, do it for you. Don't do it because, you're going to think that you're going to get a man or that, do it because you want it. And if someone gives you a hard time, sit with that and think about, what's going on here. Decide what you want. What works for me may not work for you. Okay? So, yeah, I'm not finding these other questions, so I'm hoping that I will remember them. So one of the questions was, I told you a little bit about the pre-op, and then I'm going to talk a little bit about the post-op. If y'all have questions, put them in the comment section, so don't message me, if you would, please. So the pre-op is the basic, it's just pre-surgery stuff that you've been told, but the big thing is, because there will be a lot of potential for bleeding, I had to stop ibuprofen. I take turmeric and curcumin for my arthritis, and so I had to stop that. I am always a panicky freak about IVs, and so I'm, hydrating rather passionately so that they don't have any trouble finding my veins. Glasses. So I forgot. Hang on.
I'm having trouble connecting to the internet. Check your Wi-Fi network connection by going to settings.
Thank you, Siri. Okay, so this is the beautiful little compression thing that I'm going to be wearing. Let's see. I know y'all are jealous. You wish you had one. An interesting thing about communication being such a fragile thing, I thought I was only going to have to wear this for 3 days, and I'm going to be wearing this for 3 weeks, 24/7. And part of that is, as I've mentioned on several occasions, they're taking the skin off my face. And so this compression helps keep the swelling down, helps prevent hematomas, which are little blood pockets or serum pockets. So it helps everything go back together the way it's supposed to. So I'll be wearing that. I go in tomorrow morning at 6:30. They get everything ready. They're going to draw all over my face so that he knows, because you want to be vertical. And yes, Sandra, 3 weeks. That's exactly what I said. Oh my God, 3 weeks? They'll be drawn on my face. He's agreed to take pictures of that. And so you'll be able to see what the little lines that they make so that they know, because when you're laying back, we all know how different you look when you're laying down versus when you're vertical. Also, he's agreed, this doctor is fantastic in that he explains everything, but he's also not shy. He's not camera shy. And he's happy to explain things. And I told him that I wanted to do this as transparently as possible so that y'all can go along with me, basically. So he is going to take pictures of the drawing, but he's also going to do some, I told him nothing gross, but he's going to do some videos of the surgery itself. And then when I get to a point after the surgery where I feel like I'm conscious or comfortable or whatever, I'm going to let y'all see what it looks like right after the surgery as soon as I can. So that's going to be tomorrow, Monday, and then I stay in the hospital overnight. And I will have drains. He does prefer drains because they're, I don't know if y'all can see this, they are, pulling this skin away, because they're going to be sewing these muscles together, and he's going to be removing fat. So there will be a drain, and Tuesday morning he will come to see if that drain can come out. And if not, I have nurses checking on me here in the hotel room. But then they'll release me to come back to the room. A nurse will bring me to the room, and she will help me change the dressing. As I understand it, they say that you can wash your hair the very next day. So that would be, I guess, Tuesday afternoon. Again, communication being the fragile thing. I have it in writing here, but I gotta tell you, I've seen some of these stitches, so I'm a little bit surprised that they say that you can, wash your face and hair, but I'll let y'all know. I'm gonna try and be as transparent as I can. But they say that your hair is a mess because, they pull all your hair away and they wash, thankfully, to just have it super clean, because they don't want any infection getting into the wounds. Some of you have asked about post-surgical treatments, so I want to talk about that. Here, I have elected to participate in, purchase a package of 5, I'm going to call them lymphatic massages. Don't tell the nurses that's what I'm calling it, because they call it therapy. But it's a combination of lymphatic massage. I think there's some sonogram treatment. There's some light therapy. I mean, there's several different things that they do over the course of, I think it's about an hour, where they're helping to move the fluid and helping to make sure the skin is, just taken care of in an optimal shape. So that's what I'm going to be doing the week after the surgery. What else? Somebody else asked me another question. Oh, glasses. This was interesting. So cannot wear glasses the first day because the bandage around my head's going to be so big. So I doubt if I'll be answering questions or communicating much. And if I send any of y'all a text that makes absolutely no sense, it's because the bandage will be too big. He says I can go like this, so we'll see how that works. Another one of y'all asked me a question about changing the dressings. They want you to change the dressings twice a day. I may or may not be able to show you that. Oh, Mystique, I would agree with the monocle idea, except they're going to have done the eyelid surgery, and I'm betting I can't squint to hold that. But maybe a monocle. Do they make monocles on sticks? Maybe I could do that. That's a good idea. I may go look for one of those today. What else? Eating. So I don't know if you can see. Let me see if I can show you this. Yeah. I got a suite here, and then I mean it's a beautiful hotel. It's got a special rate because I'm at the Panama Clinic, and I've done some shopping, and I'm gonna be magnifying glass would absolutely work. Y'all are great. I'll just call y'all and get a video and just hold it up, and y'all can tell me what it says. So, but anyway, food can't chew. They say the first couple days because your skin feels so tight and you may be a little sore. So I actually have gotten like soups and stuff like that. The thing is, and I've had I was surprised at the number of you who were commenting about traveling alone, but I have to tell you, I highly recommend it in that I don't have to take care of someone else, and I don't have to. Women, we kind of suck about having someone take care of us, but if it's a nurse, isn't that funny? I'm going to pay a nurse to check on me, and then I'm paying for these therapies, so I go into the doctor's office every day for 5 days. That doesn't bother me. But if I had a friend with me who was caring for me, for some reason that would make me feel self-conscious. I don't know. More things that we have to work through, right? I cannot think of any other questions, and I hate that I can't find that piece of paper, which I literally just had a minute ago. If y'all think of questions, I am going to be on the online. I'm going to post pictures. I doubt if I'll do a Facebook Live for the first few days, only because I'm probably going to be on some pain medicine, and I don't know that y'all need me unfiltered like that. I'm looking just to see if I've misplaced that little piece of paper. Have not. Y'all, thanks for being so patient. One of the things that I do remember somebody asking me about was, am I scared or nervous? I'll be honest, y'all don't laugh at me. I'm more nervous about the IV than I am about anything else. I try to live a super intentional life. And so I have thought about this. I think everything in our lives, from brushing our teeth to cooking, is a spiritual experience. And we have this one precious life, and I don't want to make decisions based on ego or vanity or anything like that. And so I really, really thought about this, and that's a great question, Sandra. For me, I am not scared. Everything came together so smoothly. I believe in my heart that this is like the universe has said, yes, this is the right time. And I'll tell you all a story, since I can't find the questions. I had contacted almost 6 doctors. I think it was 5 or 6 doctors. Nobody answered me. One doctor answered me, but he was kind of squirrely about being consistent. And I have a theory that it doesn't get better than the first date. And so if I'm not even your patient yet, and you're not engaging with me, you're not going to engage with me more after I give you money. You're going to engage with me more now because you want my business. So I thought that was the universe telling me no. And I was a little disappointed, but, And then I had a woman reach out to me. Her name's Lisa, and she has had 3 procedures with this doctor. And she messaged me again, didn't want to post anything in public, but she messaged me, and gave me his email, and I emailed him at 8 o'clock at night and had an answer from him at 6 in the morning. His office called me the next day. We had scheduled a call. So long story, super long. I think everything has happened the way it's supposed to. I would be irresponsible, I think, if I didn't feel nervous, Sandra. So yeah, I feel nervous, but really it's not anxiety about the success of the procedure. It's, 62 and having surgery, right? And what if? What if I don't like it after they're done with it? Or I've had Bell's palsy. I don't know if y'all have ever noticed, but that's why I have this quirky little smile. This side of my face doesn't work correctly because if you're not familiar with Bell's palsy, it's an infection of the 7th cranial nerve. And so essentially this side of my face back in 1999 maybe was paralyzed for 2 weeks. And then the feeling came back about 75 or 80%, but when I'm tired, this side is really droopy, and you can see when I smile or when I talk, I don't know which way, it doesn't work. So I was worried. We had a talk. I had the talk with the doctor about, what's this going to do to that side of my face, and, how will this affect the nerves, and will I still look wonky? And there are things you can control and things you can't control. So that's a super long answer to a simple question. So yes and no, kind of, sort of, sometimes depending on what day you talk to me about it. I'm eager. It's kind of like, it feels like you're on a roller coaster and you're right up at the top and you can't get off, right? You can't get off the roller coaster, and it's just getting ready to go. So that's kind of what I feel like. Good books to read. Okay, so I don't know about the reading, but movies or shows to watch. I actually brought my little Amazon Prime little video thing. I was hoping to watch TV with English subtitles so I could practice my Spanish, but the subtitles don't work on this TV. So yes, please recommend. Please recommend. Okay, let's see. Yeah, so Sandra, yes, your friend had it. Her left eyelid drops when she is sick or tired. That's exactly what happens to me, Julie. When I'm exhausted, this side just, they used to call it the truck driver's disease because truckers were the first ones to consistently get it. It's caused by an upper respiratory infection, and the wind bashing on this side of the face would cause truckers, that 7th cranial nerve, to become inflamed, and so they would get this. I got it because I had a fan. That's why they say you shouldn't have fans blowing on your face when you're sleeping. A big fan overhead is fine, but those direct fans, it can cause this. So it's a little, it's 25 years ago, but I will say, there are days when I feel like my face is broken. But yeah, so. Okay, I don't want to blather too much longer, but I will keep y'all posted about what's going on, and hopefully I'll be able to post some pictures tomorrow with all the other pictures and videos the doctor's going to take. So thank y'all for being interested and willing to go along with this with me, and just good mojo tomorrow. It's a 5-hour surgery. Starts at 8 o'clock in the morning, and so if you think of me Monday, July 23rd, 2023, anytime between 8 and 2, definitely good mojo. So all right, well, that's it. I appreciate y'all being here, and bye for now.